Ramsey is here from the Center for Natural Healing to talk about melatonin. And I'm like, melatonin, melanin is the stuff in our skin. Melatonin is two different things.
Yes.
Thank you. What exactly is melatonin?
It's a hormone that's made in the pineal gland, a really small gland right in the center of our brain. Okay. It was coined by a French philosopher at the seat where the seat of the soul lives. It's right in that pineal gland.
And some people don't get good sleep, so does that mean they're not producing enough melatonin?
Right, and so we do know for certain that when we're young we make the most, and as we age, just drops down. And it was discovered in 1958, but it wasn't until the 1970s that we realized how much it helps with sleep, and how much the decline of melatonin will contribute to lack of sleep.
Well, you always hear too, as you age, oh, I don't sleep as much, I could go all day on just a couple of hours sleep. Is that true? And is it good?
Well, it's never good to not sleep. And then you want to identify the cause, and many times it is melatonin. It might be something else entirely, but melatonin is so safe. And the other uses of melatonin besides that, and I want to teach your viewers how to dose it so that it does work, because for many years I didn't even think it worked until I started seeing the recent research. And then in the 1990s what came out, it exploded, was how much melatonin protects our immune system, and what an awesome antioxidant it is. It actually quenches free radicals from our body at the very end and just eliminates it.
Because most people, if they can't sleep, they take some sort of over-the-counter prescription.
Something else. Right.
And that has so many side effects. This is an all-natural way to increase.
If you can take this and it works, getting better sleep, deeper sleep, more healing sleep, you're also getting all the benefits for the immune system as well.
Okay, now why did you say at first you weren't a believer of it?
Well, I've been in practice now for 14 years, and in the very beginning, you take from medical school and you practice. And the dosage was never, ever have a patient take more than 3 milligrams, and never if they're below 12 years of age, with all of these, rules. And so many kids would then come to me for the treatment of focus issues or autism, and their psychiatrists have them on melatonin. So I'm scratching my head thinking, okay, we learned this isn't safe. Then we would prescribe it to adults for sleep, and we weren't really getting good results. So this was years and years ago. Now we know that not only is it safe in children, it's recommended for certain conditions, and that the dosage that's prescribed is what's the most important thing. And you and I might need very different dosages of melatonin. There could be a 50 milligram difference in the dosage need.
Why would kids need melatonin? I don't know any kid that doesn't sleep through the night.
Some kids who, especially if kids are born to older women, like when I had my son, he didn't sleep at all.
Really?
And it took me a year to figure out he was deficient, I was deficient. We both still take it every single night.
Wow. Now, so you're not talking infants, because we all know they don't sleep through the night. You're talking as they get older.
Right. And infants also maybe, too. And in fact, just along that note, there were studies on children with autism, and they looked at the parents who had melatonin deficiencies, and it was actually a genetic weakness where they couldn't process melatonin. And so the child then developed that, and then had other influences that contributed to the outcome of autism.
What if your child is one of those kids that kind of get up and have night tremors, or maybe even sleepwalk, or just move around a lot? Would that be an indication?
Absolutely. Restless sleep. Children who wake frequently, even if it's just to urinate, because children should be able to sleep through the night. It would be beneficial to try some melatonin. And you can test your melatonin levels. It's a saliva test.
Okay.
The reason I don't do it is because that doesn't tell us how much a patient needs, because we all have different requirements also. And so how to really know, and this is what I tell my patients all the time now, and finally we're getting really good results using melatonin, is you start with a low dose, say 1 milligram, 2 or 3, and you can buy them in health food stores in capsules, creams, chewable tablets. There's so many different forms it comes in. You want to make sure it's pure, because sometimes melatonin has all these other sleepy herbs in it, just pure melatonin, and you take that low dose an hour before bed. If you didn't fall asleep well or didn't sleep well through the night, the next night you double that. Then the night after that, again, you just increase it by that 1 dosage each night until you find that you're falling asleep and staying asleep, and that's your dosage.
Okay, so adults who are saying, oh, I don't need that much sleep, an average adult, 40 above, still needs a good 8 hours, no matter what?
That's
no matter what your age?
No matter what your age, you absolutely do.
Okay,
absolutely do.
Interesting. Yeah, I hear a lot of folks who say, oh, I don't need it, but maybe.
Right.
Thanks, Dr. Ramsey.
You're welcome.
Really good tips there. So if you want more information, of course, to contact Dr. Ramsey, you can do that by going to our website, azfamily.com/yourlife, or call our hotline. You'll sleep better now.